Welcome to our Community Health Assessment presentation on Charlotte, North Carolina. The focus of this presentation is on the prevalence of cardiovascular disease among African Americans in the NODA community, which is located in the northern region of Charlotte and Mecklenburg County. There are various health issues that are prevalent in Mecklenburg County and a variety of diseases and processes. Of the health issues in the community, we chose to focus on cardiovascular disease. Why cardiovascular disease? Well, number one, cardiovascular disease is the second leading cause of death in Mecklenburg County today. And two, many of the risk factors for this disease are very preventable. In order to investigate this disease further, we wanted to find a location with high rates of the disease in the county. After investigation and research, we selected the NODA community in North Charlotte. From here, we examined the environment, the population, and the resources in the community, ultimately narrowing our focus to African Americans with the disease. Strengths and weaknesses of the community were examined, and diagnoses and interventions were formed in order to reduce the rates of cardiovascular disease in this NODA community. In order to really immerse ourselves in NODA and to gain primary data, we conducted a windshield survey. What we saw is that this community is bordered by a large interstate. The housing in this community is old. There are some trendy homes being built and the area is growing, but the majority of the homes are old, run down, and not well taken care of. There are numerous common areas and open spaces ideal for running, walking, or physical activity. We did find numerous homeless individuals in these common areas. In regard to transportation, most individuals got around by foot or by taking the city bus. The cars seen were older and run down. Numerous individuals were smoking while roaming around outside. When it comes to culture, we found NODA is a very artistic community. There are numerous fast food restaurants in the area and a lot of advertising for these restaurants. There were several newer trendy restaurants and bars, along with a couple of fresh food stands, but the price tag at these establishments was likely not very affordable for the population we were seeing. There were many races and ethnicities represented, including Caucasian, African American, and Hispanic, as well as many homeless individuals. However, the majority of the individuals we saw were African American. Access to healthcare in this area is very limited. There are minimal doctor's offices and dentists in the community. To gain additional insight in the community, and specifically to gain insight into the prevalence of cardiovascular disease among African Americans, we interviewed an RN at a low-cost clinic in the area. We were able to gain additional information on the challenges this group faces. She felt that obstacles for African Americans in this community were access to health care, which we saw in our windshield survey, non-compliance. She stated many individuals are not compliant when it comes to eating healthy, exercising, and taking their medication as prescribed. She also noted a lack of understanding as a challenge. Many of the individuals in this area are of a lower educational level and simply do not understand the how or the why. When asked about keys to improvement and success, she noted that there should be more low-cost clinics, additional free screenings where individuals are able to monitor their blood pressure and cholesterol, improved educational initiatives, an emphasis on follow-up care. In the clinics, like we mentioned, they have a high rate of non-compliance, especially with follow-up care, and then just simply motivating individuals to understand that how and the why. We are now going to move on to our secondary data and demographic data in particular. As you can see, the population in 2015 of Charlotte, according to the U.S. Census Bureau, was a little shy of 810,000. And this was pretty evenly split between genders. As you can see, about 48% are male and about 52% female. When we look at educational data, you can see about 88% of individuals in the county have a high school diploma or higher, and about 40% have a bachelor's degree or higher. These numbers are lower in the NODA community we are focusing on. And then when we look at income, you can see the median household income in 2013 was around $52,000. The below poverty level was about 17%. Our unemployment rate in 2014 was just above 15%, and the median home price in 2015 was right around $140,000. And just another note to make that the unemployment rate and the poverty level, as we saw in our windshield survey, is higher in the community we're focusing on. When we look at language, 20% of residents speak a primary language other than English, which can certainly be a barrier when it comes to health literacy and education. You can see some other general statistics here. About 47.5% of individuals are married. The median age is about 33. The average commute time to work for those who actually have transportation is about 25 minutes, and the average household size is 2.5. Looking at some of the largest employers in the region, you can see here Carolina's healthcare system and Wells Fargo employ the most individuals. Other large employers include Walmart, CMS, which is a school system, Novant, which is a main competitor of Carolina's healthcare system, Bank of America, American Airlines, and Lowe's. And we saw very few of these companies represented in NOTA during our windshield survey. Now, when we take into account the top causes of death, according to the Health Department in 2013, cardiovascular disease was number 2. Now, this has been pretty consistent over the past several years. And actually, cancer and cardiovascular disease combined account for over 50% of deaths in Mecklenburg County each year. Stroke has been the 4th leading cause of death since 2008, and diabetes, which has many of the same risk factors for cardiovascular disease and can contribute to cardiovascular disease, ranks in at number 7. When we look at risk factors for chronic disease and cardiovascular disease, we find some alarming statistics. 20% of individuals in the area report no physical activity in the past month. Now, this may not seem that high to you at first, but when you consider individuals should be getting 30 to 60 minutes of exercise a day, this number is pretty high. 20% of people report smoking. Again, we feel this number is higher in the NOTA community we're focusing on, just from what we saw in our survey. And over 80% of individuals report eating less than 5 servings of fruits and vegetables a day. This is not that surprising considering the abundance of processed and fast food in our society. Around 30% of individuals report having high cholesterol or high blood pressure, and these are just the individuals who know they have these risk factors. Again, a lot of people in this NOTA area do not have access to care and are unaware they have these problems. And finally, an alarming 62% of individuals are overweight or obese, which is a major contributor to this disease. When we break chronic disease down by race, and in particular cardiovascular disease, again, as you can see here on the right, it can be a little bit deceiving at first. About 15,000 more Caucasians have cardiovascular disease in Mecklenburg County than African Americans. However, the population of Caucasians in the county is much higher. So when you look at percentages, African Americans have a lot higher percentage of the disease. There's actually a 1.5 disparity ratio between the two. You also see on the left here that African Americans have a higher rate of diabetes as well, which is a major contributor to heart disease. It is important to remember that other factors may skew these results a little bit. When you look at the big picture, African Americans have a higher rate of unemployment and lower income levels than Caucasians, and these are factors that may contribute to cardiovascular disease more than race alone. And this graph just supports what we just discussed in the sense that there is a higher population of Caucasians than African Americans in Mecklenburg County. As you can see here, about 46% are Caucasian and about 35% are African American. When we take a look at lifestyle data, we find substance abuse is a problem among high school students. And unfortunately, these individuals are likely participating in other unhealthy habits that could lead to heart disease in the future. When we look at the environment, Mecklenburg County is doing a pretty good job. Air quality has significantly improved over the past decade, and there's an emphasis on creating greenways and places to exercise in the community. And again, we did see a lot of area for activity in the NOTA region. When we analyzed our primary and secondary data, we were able to come up with strengths and weaknesses of the NOTA community. The strengths of this area are that the racial and ethnic diversity is greater than most other areas of Charlotte, and this is a good thing. There's also a broad socioeconomic mixture. We have individuals of both higher and lower income in this community. And this community is growing, which is exciting. There's also plenty of space for physical activity to run, walk, and exercise. There are a couple of fresh food stands, as we mentioned, and although they may be out of the price range for a lot of individuals in the community, at least it gets people thinking about eating healthy. When we look at weaknesses, there is poor health literacy in this area, and a lot of this has to do with educational levels. There is also, as we saw and heard from our interview, minimal access to healthcare in the community. And the affordability and accessibility for healthy foods is also a big issue in NOTA. Our strengths and weaknesses of the NOTA community lead us to our community health diagnoses. And obviously these are related to cardiovascular disease as well. Our first is ineffective health maintenance. A lot of individuals in this area are of lower income and honestly may be more worried about actually getting to eat than whether their meal is low in sodium or unhealthy saturated fat. They may work multiple jobs and be more worried about getting to that second shift on time than working in the recommended 30 to 60 minutes of physical activity a day. Unfortunately, this is a reality for many of these individuals. Our second diagnosis is lack of knowledge related to wellness. These individuals have not been taught how to live a heart-healthy diet or may lack the understanding of the how and the why we previously discussed. Three significant health problems in this community are cardiovascular disease, poor health literacy, and minimal perceived access to health care. Although there are a lot of options for health care in the greater Charlotte region, this community does not offer much, and many of these individuals do not have transportation. Areas specifically affected by cardiovascular disease include low-income areas, the homeless, minorities, specifically African Americans, and individuals with lower educational levels. And we see a high prevalence of all these factors in the NODA community. Our diagnoses lead us to our interventions, and what is encouraging about cardiovascular disease is that it is very preventable. In fact, the ratio of controllable versus uncontrollable risk factors for this disease is 4 to 1. So our primary intervention is really going to focus on preventing the disease. We want to improve health literacy through regular seminars and information sessions where we focus on helping individuals achieve a heart-healthy diet and find ways to balance a budget for healthy foods. We also want to teach creative ways to incorporate exercise into these individuals' lives on a daily basis. These information sessions will be achieved through partnering with local schools, businesses, and churches. We also want to encourage a tobacco-free environment. Our main goal is prevention, and we really want to get individuals talking about and getting excited about preventing this disease. With our secondary interventions, we really want to halt the disease in its tracks. To do this, we're going to incorporate regular screenings and exams for those in the community. Here, individuals will be able to have their blood pressure and cholesterol checked, along with reviewing diet plans and helping with medication fills and compliance. When we talk about tertiary intervention, we really want to focus on managing the ongoing illness, so managing the cardiovascular disease. Here we're going to obtain volunteers from local organizations. We want to form support groups for those with the disease. We want to do this so they can meet others in their situation. Hey, maybe they can even become friends and really hold each other accountable to ultimately help manage the disease. We also want to utilize volunteer organizations such as Physicians Reach Out and the Community Alternative Program, which helps disabled adults in their home. Some of the barriers to our interventions include transportation, which we will address by using organizations such as the Community Alternative Program. We want to utilize community bikes, which are newer to the area, and make sure to really set up the transportation when we're helping individuals schedule appointments. We want to offer non-traditional hours for our seminars and our screenings and our support groups, just so that we can cater to everyone in the community who may be working odd hours. And we will also offer a video interpreter for those who speak a primary language other than English. In conclusion, when we look at cardiovascular disease, what is really scary is that it can often be a silent killer. Many individuals do not know they are walking around as a ticking time bomb. African Americans in this NODA community of North Charlotte are especially at risk for this disease. This is because of low health literacy rates, minimal access to health care, the environment, and low income levels. In order to really prevent this disease and combat it effectively, primary, secondary, and tertiary interventions must be implemented through the effective implementation of seminars and information sessions, screenings, and support groups. It's really time to get this community excited about preventing heart disease. Thank you for your time.